You're listening to Your Best Life, powered by MercyOne. Join us as we have a fun conversation with certified experts and physicians about health topics for you and your family. It's Your Best Life, our one purpose.
Welcome to the MercyOne Your Best Life podcast. It's a podcast where we discuss topics that help us to live well. In this podcast, we're talking about radon, a colorless, odorless gas that appears naturally in the environment and is very prevalent in Iowa. The Environmental Protection Agency says radon can cause lung cancer. Maria Steele, a healthcare provider, is on a lung cancer journey attributed to radon. Maria, thanks for joining us today.
Well, thanks, Greg, for having me. I really appreciate this opportunity.
Tell me about just your background and how this prepared you for what became a journey with radon.
Yeah, and I appreciate you using that term journey. As we all know, in the media, on social media, print media, there's always an issue of, you need to be a warrior, you need to fight, you need to keep fighting the battle. And I get all that, but for me personally, I like to see this more as a journey, as you said, because, on a journey, most of the time you can pick where you want to go. You can choose who you want to travel with. And I've been very fortunate to have some very important people in my life travel that journey with me. Yeah, I think being part of a large family and learning the value of hard work, we all, well, not all, but a lot of people grew up with the idea that, you work hard, you play hard. We also grew up with a strong faith, which has been a huge part of this journey for me.
Now, had you heard about radon before? And what have you heard about radon, including, did you know Iowa's number one in the country for radon?
No, I did not know until I was diagnosed. I had heard of radon being dangerous, just like we knew that carbon dioxide was dangerous and there could be high indoor levels and that there were different devices that could measure CO2 levels in the home. But I, in my wildest dreams, did not realize that radon, as you said, was prevalent in Iowa. I mean, we lead the nation in radon exposure. If you look at the map from the EPA, there are other states that are highly affected by this as well. And I think that's what we need to do, is to get the word out on that to, our primary care providers, because, they ask about seatbelt use, they ask about tobacco use, but they don't routinely ask about, have you checked for radon in your home? And I would love to see that change, but we'll see.
And how did your journey start with lung cancer? It's fairly recent.
Yes, it is. So I was diagnosed the week before Christmas, 2019. For a couple of months, I had been experiencing a fullness and a heaviness in my chest, just a dry cough when I laid down at night. And then probably a few weeks before I was diagnosed, I had started noticing this kind of crackly sound when I breathed in. And I had never heard that before. And as a non-smoker, I thought this seems kind of strange. And the fact that just in that July before I went for further testing, my youngest brother, Dan, who was a captain, a pilot at American Airlines, had died of a stroke. I mean, he was 54 and had been playing competitive tennis. So I was very aware that I needed to get everything checked. We also have a very strong family history of cardiovascular disease with two of my other brothers, and my mom's had a pacemaker for years. So I knew I needed to get the heaviness in my chest, especially, and the cough figured out. And I also knew from working as an ER nurse for years that cardiac disease presents differently in women. Everybody thinks of the crushing chest pain with pain going down the left arm, and that certainly happens, but that's actually a more common symptom in men. So I did have, I made an appointment to see a cardiologist, had a treadmill, had an echocardiogram, passed with flying colors, had carotid ultrasounds done because of my brother's stroke, and those were all fine. And so then I thought, well, I've got this dry cough at night. It could be reflux. I had worked my entire nurse practitioner career at Iowa Digestive Disease Center, and I knew that one of the signs of reflux could be a dry cough. So I took it upon myself to just take an over-the-counter heartburn medication for about 2 weeks. Absolutely no change. Finally, my husband just said, Maria, go see Dixie Harms. This has been going on too long. So I did, and she did a chest x-ray. She called me into her office. She had me wait, and she actually showed me the x-ray on her laptop. And she said, we really need to get this followed up. It looks like there's a possible tumor. You may have emphysema. You may have pneumonia. And I shook my head, and I'm like, that doesn't make sense. I don't smoke. I've never had symptom. I've never been around secondhand smoke. Never grew up around neither of my parents smoked. I was just incredulous that it could be something with my lungs. But we were able to get a CAT scan ordered 2 days later. And then it looked like a primary lung tumor with quite a few lymph nodes in my chest that were enlarged, which was the cause of the chest heaviness. And so we ended up getting further testing done after that. And I found out that Friday because Dr. Ben Johnson did tell me the preliminary diagnosis of lung cancer. And that was just a shock. I mean, we were shocked when we got the results of the CAT scan on that Wednesday night. I just couldn't. I was totally unprepared for that. Couldn't believe it, and thought, well, we need to do more information. We need to get more information here. Let's try not to jump to too many conclusions. But by the end of that week, we knew what the conclusion was, and that was lung cancer.
Now, as a health professional, I've heard that for individuals who are told they have cancer, they hear the word cancer and then don't hear the rest of what the professional is sharing because it is such a shock. It sounds like you were able to process that and then become proactive for yourself and begin to take the steps that you needed to deal with this cancer that appears to have been caused from odorless, tasteless, sightless gas.
Right, exactly. No, I felt very fortunate. As Dr. Deming made a comment once, he goes, you've been on both sides of the stethoscope. So that once there is a diagnosis, and actually when I would tell my patients as a nurse practitioner that they might have had, colon cancer or something like that, you always want to have the next step ready because you don't want to say, hey, you have colon cancer, and now we're going to try and get you in to see an oncologist or a surgeon. They want their plan. And I understand that not only as a nurse practitioner, but truly as a patient. I mean, I always thought I had empathy for my patients, but I really would have that empathy ramped up as a result of this journey that I'm on.
And with the diagnosis proceeding so quickly, you had the ability to receive care right away because that diagnosis showed that you needed to get on it right away.
Yes, that's true. And don't we all want that? As soon as we know we have a terrible diagnosis like that, we don't want to just sit and think about it. We want, at least I did, I wanted action. It's like, let's get this taken care of. And again, thanks to my colleagues helping me with that, things did move along quickly. And I needed, after I had that bronchoscopy, to get a biopsy. Once I knew what that was, Dr. Johnson had said, well, you're going to need more testing because it's very common for lung cancer to spread to your bones, your liver, and your brain. So you're going to need an MRI of your head. You're going to need a PET scan to look at the rest of your body. So that was set up the first week of 2020, because again, my other procedures had been right before Christmas, and we all know things slow down at Christmas. People are on vacation and all that, unless it's an absolute emergency. So again, I was still needing more testing, which I wasn't aware of. I'm not an expert in oncology at all. And so I had my brain scan and the PET scan. And I actually saw a report of my MRI, and I was at work because I had asked for the report to be sent to me. And so it was sent to me, faxed over. And so I couldn't look at it until the end of the workday. But when I did look at it, and I would always tell people, I just want to see it. I can handle it. I want to see it. If there's further information, I'll wait and talk to the oncology people. But I know how to read a path report. I know how to read an MRI, a report from the radiologist. So that day, I remember reading that there was metastasis in my brain, 6 different lesions. And I couldn't wait to get home and tell my husband. So I did tell him, and we both broke down because we knew that it was now worse than we thought. We thought lung cancer is bad enough. Well, now you've got it in your brain. And we also found out that it was throughout my bones. So thankfully my liver's okay, but widespread metastasis in my bones. We literally drove to our church. I fell on my knees and asked God to help, and felt better after that, because there's certain things that you just can't handle on your own. And this was one of those things. So we have had the support and prayer of so many people. It's made a tremendous difference in my life, and I feel like in my journey.
That support is so important in situations like this, but also in general. In your care, you had access to a group and a team
Yes.
that was dealing with your lung cancer not caused by smoking.
Right.
That's something that people should really draw upon, that they need that extra support to go along with the great medicine that's out there.
Right. And it truly is what Dr. Deming is doing with Above and Beyond Cancer. That is a program that truly looks at body, mind, spirit. And I've been quite involved with that from the get-go. And I can't say enough good about Dr. Deming. He leads the way and really makes an effort to look at nutrition, to look at exercise, to look at mindfulness. You didn't see that in medicine. And I've been in healthcare for 45 years. It was just, you were diagnosed, you were given your medicine, and, see you in 3 months. Now I know that's probably a little bit harsh, but back in the day, no one even wanted to be questioned. It was, here's the best treatment, do it, and hopefully it'll work. I think things today are much better. I think there are conversations with healthcare providers. People are more educated. I'm not saying everything's wonderful out there on the internet as far as data, but you can look at good sources. You can read the medical literature, and I felt that I had an advantage as a nurse practitioner to be able to look through the data. Although I will tell a little incidental story. Before I went to see Dr. Behrens for my very first for my very first visit, I did some research because obviously I knew lung cancer was bad, but I wanted to see if I could find any information on brain metastasis, because the big question is, how is this going to affect my life? Am I going to am I going to be dead in 5 years? I mean, what's happening? So I actually found a PowerPoint presentation online. I think it was Yale Medical School, and they were actually talking about lung cancer, primary lung cancer, non-small cell lung cancer with metastasis to the brain. And I'll never forget the slide because the first bullet was life expectancy 3 to 6 months after diagnosis.
Shocking.
It's like, I mean, I closed my computer. I thought, okay. And that was 2016. That was a lecture given in 2016. So not that long ago. But I thought, okay, that's enough. I'm going to wait and see what Dr. Barron says, and we'll go from there. So, so I did ask him that question at one of our first visits. And because, I mean, he hadn't really mentioned it. And I'll be honest, as a nurse practitioner, I would give someone a diagnosis and they would say, well, how long do I have? And I would always typically say, you know, it's so variable. I can't give you that answer. I don't have a crystal ball. You know, I can't tell you. But I thought after reading that PowerPoint presentation, I really wanted to ask Dr. Behrens his opinion. And he said, well, Maria, the average person with your diagnosis, with the size of the lung tumor, the fact that you have metastasis to your brain, the average person lives a year. And I was like, no way. No, I don't feel that bad. You know, that's not going to be right for my situation. So, and he said, no, I get it. He said, but you got to realize the average person means the average 50% will live longer, 50% will live less. And he goes, I think because you're already in such good health, you don't take any prescription meds, you're not overweight, you will do better than the average person. So I felt good about that. I felt better than thinking I had 3 to 6 months. That's for sure.
You can sense that as you began to receive your care, you began to advocate for yourself and ask those questions. Is that an important part of the equation in dealing with radon?
Yes, that's a great point. We did talk about radon, and I had done some research on that because part of me was like, I've never smoked, don't have all these risk factors. Why me? Why is this happening? And that's when I found the research on radon. And then when I went to the EPA website and saw the map of the United States and realized that the whole entire state of Iowa, plus a lot of states to the west and north of us, I mean, I think everybody should go to that website and take a look if they have loved ones in other states and whatnot. But, and interestingly, my dad's sister was just diagnosed with lung cancer. She lives in Northeast Kansas. Northeast Kansas is just as red as Iowa. So it is, I felt that since I decided to retire about a year or two earlier than I was originally planning, you know, you always want to help others and advocate for them. I mean, that's what nursing is all about, you know, educating the patient, advocating for them. And I wanted to continue to do that, not only for myself, but for others, because if this was affecting me, and I've been in healthcare seemingly forever, and I wasn't aware of this, then the word needs to be put out. And that's when I learned about Gail Orchid. Gail Orchid was a tireless advocate. So she'd already been doing the work on radon. She had developed lung cancer 10 years prior. She was an educator for 33 years. And she brought up the issue of radon not only in homes, but also schools. So our daughter, Val, has been an educator in Waukee schools for the last 10 years. And so it just shifted my thinking. This isn't just residential homes. This is schools and workplace as well. I mean, how many hours do we spend away from our home? I mean, forget about 2020. We were all home in 2020, but that's probably an even better reason to know what your home's level is. So,
Yes, and in looking at some of the information from the EPA, it's not something that's just in a basement. Radon naturally appears in the environment, and in the case of Iowa, glaciers played a role in the state, which impacted our soil and made it easier for radon to come to the surface, as it were. And so
right,
those are things that people should be paying attention to and beginning to monitor for.
right,
Correct?
right. Correct. You're exactly right. And I've had so many people say to me, well, no one sleeps in the basement, so I'm sure we're okay. Or we live in a slab home. We don't have a basement, so we're going to be okay. That's not correct. So most homes are built, even the foundations are built on at least 4 inches of rock. Well, that allows the radon to seep up through the soil and to come into our homes. And where are the HVAC systems? They're not on the second floor. They're in the basement, and they're circulating air throughout the home. So especially in winter, when most of us here in Iowa keep our homes, tightened up, windows closed, that will raise the rates of radon in our home. I mean, summer, if you've got your windows open, it's a little less, but yet the overall feeling is that radon is there. And it is, you're right, it is out in the environment, but it's diluted. When you're in a home and your doors and windows are shut, you've got an enclosed area. It's in water. So I think actually Northwest Iowa has the highest concentration of radon of all the counties. So that's something else to think about.
I think is an important message as well. This is something that can be detected and should be monitored, not something to fear.
Correct. I mean, thank you. That's a really good point as well. So it's easy to test your home. So you can go to any hardware store and find an at-home test kit for radon. It'll cost $12 to $15. You take it home, you put it in the lowest level of your home. It's like a peel back little tray, and then you send it in and you'll get results within a week or two. We did that originally, and the level was high. Once I was diagnosed, we did it. The level was high, and I thought, well, let's just double check. And so 2 weeks later, I did it again, and it was a little bit higher. So the EPA currently recommends that if your level is between 2 and 4 or higher, you should have a mitigation system put in. And we did do that. We contacted a certified mitigation expert, and he came, and within a week, we had a mitigation system put in.
Okay. And then you continue to monitor as well, even with that system in place.
Yes. So the recommendation is once you have a mitigation system put in, you should recheck it every 2 years. Now, the mitigation installer gave me another kit, and he said, I want you to do this a week after I leave, and just to make sure. And so I did that, and it was well below 2. I mean, I think it was like 0.95 or something, but I mean, it made it an objective difference. So I was happy to see that, but we'll continue to recheck it every 2 years. There are some ongoing systems that you can keep in your home. I haven't looked into that much, but every 2 years we'll definitely be rechecking.
Now, as time has gone on, radon impacted lung cancer, and lung cancer in general has become the number 2 mortality cause in the state of Iowa. And so it shows the seriousness of it. And, as part of the seriousness, and also as part of trying to help individuals, do you think there needs to be something done publicly through government or other means in order to encourage action? Because that's a major impact.
It is a major impact. And some of the things that I learned during my research, and I'm a member of the American Cancer Society Cancer Action Network, and they have a work group on radon. I'm also a member of the Iowa Cancer Consortium. Again, they look at all cancers. But what I found was lung cancer in general affects more people than breast cancer, colon cancer, and prostate cancer combined. And yet the national funding for that compared to breast cancer is really surprisingly low. I, of course, have nothing against funding for breast cancer. I would never even think that. But I think that the national funding for lung cancer, since it is such a killer, needs to be higher. So that's one piece of it, is that research funding needs to be increased. But lung cancer in Iowa kills just as many people as traffic accidents. And if you drive down I-80, you see every Monday morning a different message about traffic accidents. I would love to see, have you checked your home for radon? It kills just as many people as traffic accidents. So I think public education needs to be done. I feel like the American Cancer Society and in particular the American Lung Association both do a good job of doing that. And if you actually go to the EPA website, their focus this month is on radon. So the information is out there, but I think the average person still is unaware. So I post stuff on my social media. We have a blog that we've had now going on 2.5 years, where I've documented my cancer journey. I just think the more people that talk about it, the better. And again, as I mentioned previously, I would love for primary care providers to talk about it more with their patients. As a primary care provider trained, I'm board certified in family practice, I realize that there's a lot of things you have to talk to about patients, but again, if you could post something in each exam room that talked about the dangers of radon and just had a quick handout to give to people, I think that's a start. Also, with regards to government intervention, I had mentioned Gail Orcutt earlier. She was tireless in trying to get government to require that schools be tested for radon regularly, and if it's positive or if the levels are high, to have mitigations installed. So again, the Iowa Cancer Consortium and the Iowa Cancer Network, the American Cancer Society Action Network are working diligently to get that introduced and hopefully passed this year. Gail worked on it for 10 years. She and Dr. Deming would go to Washington, D.C. to talk about it. I think everybody at the State House, it sounds like they knew her. Personally, I never met her, but if you Google Gail Orcutt and radon, you'll be reading for 3 hours. She did interviews. She was just an amazing person. And she died in May of 2020 of lung cancer and never touched a cigarette. And even her obituary, she used as an opportunity to educate people on radon. So I just thought that was amazing. And I'm really impressed by that.
And there has been progress. Some communities now with new home construction and things like that require radon tests in the sale of the home, just like you would have termite tests to buy a home. The owner had to certify it. And now radon's part of the equation in some locations in Iowa.
Right. Yeah. Iowa City has the strongest local rules in that regard even for rental properties. But as it stands right now, the state of Iowa as a state does not require that you test. You have to disclose. So if you have tested and you have to disclose what the result was. So, and yes, you made a good point about radon resistant construction. That's being used more and more as well, which is good. But again, it's not required.
Okay. And so there's work that still can be done.
Oh, absolutely. I think as far as the legislature, the focus this year and until it passes probably is to work on the radon school safety bill named after Gail Orcutt. hopefully that will pass. And then the next focus would be residential homes. But again, I try to get the word out. I wrote an editorial that was in the Des Moines Register about a year ago, and that I hope educated a lot of people. I just submitted another letter to the Des Moines Register. Hopefully that will be published, talking about January being Radon Awareness Month. So I'm just one person. So I appreciate the efforts of everyone. And there are lots of other people through the American Cancer Society and the Iowa Cancer Consortium doing work on radon. Dr. Bill Fields is at the University of Iowa. He's actually going to be retiring, but he's a member of the Iowa Cancer Consortium, and he is a worldwide expert on radon and has given talks and lectures about the dangers of radon in general. And I so appreciate his work on this subject.
Well, Maria, you've given us a lot of great information and a lot to think about. And so for an individual who might be concerned or maybe on their own journey now, what would you share with them moving forward?
I would share that the information how the radon prevalence in Iowa is so great. So to please get your home tested. Please support, at least in Iowa, when this hopefully comes to the attention of legislators, to support that, write your legislator. But I would also tell people that it's a detour. Having lung cancer is definitely a detour in your journey, but through this, you will meet many people. And if you keep an overall attitude of gratitude in your heart, that your journey will be less bumpy and allow other people to help you. Most of us can be feel like we're very self-sufficient. But if you allow others to help you, that makes the journey just so much more manageable and better. I mean, I know this probably feels very strange, but I feel blessed that I am on this journey because I have the people that I've met, the way I feel in my heart. Faith has helped me so much, and my family. And I just really appreciate all that my husband, Pat, and my family have done for me. It's just so important, and it means a lot.
Thank you so much, Maria. And I think you'll help a lot of people who listen to this podcast.
Well, I appreciate you doing this, Greg, that this is huge. MercyOne is a huge system, and I think it'll make a big difference. And I appreciate you taking the time to do this.
Well, let us know what you thought of this podcast in an email to podcast@mercyhealth.com or find us at mercyone.org/podcast. There's a form you can fill out to send us your feedback and also find all of our episodes. Until next time, live your best life.